Hello. We have a lovely lady here today. She has symptomatic varicose vein disease. And in fact, in this particular case, the small saphenous vein is very pathologic and actually is causing reflux and gives rise to branches of a varicose vein that feeds to a particular varicose vein that has actually bled before and has caused phlebitis because she has warmth and discomfort in this area. So today we're going to go ahead and try to close the small saphenous vein utilizing a technique that is called claravane. And the procedure starts with placement of a wire into the vein. And what I will first do is to numb the skin, and you're going to feel a little tiny needle prick. Tiny little needle prick. It really shouldn't hurt that much. I have a very small needle. Here we go. Everything okay? You're doing great. Excellent. And the wire will go up to the end of the small saphenous vein. We follow it with the ultrasound to make sure it's in the right direction. Little pressure, I apologize. You're okay? Is that okay? Everything's going great. So then we connect the device to its console, which is allows the power to be delivered and the rotation to begin. And the principle behind this treatment is that at the end of the catheter that you see here, there is a rotational tip that it rotates at a very high speed, and it comes in contact with the wall of the vein, and it scratches and causes abrasion of the wall of the vein. And simultaneously, we'll be injecting a sclerosing agent. In this case, it's a 1.5% sotrodacol, which, as the abrasion of the wall occurs, the agent then promptly closes the vein. The procedure does not need any local anesthesia. Because the tip of the device is rotating at a very fast speed, there will be some sensation of vibration that can be felt, but it really shouldn't be painful. Are you doing okay, sweetie? Mm-hmm. Everything's going great. Okay. You'll be happy to know that will be done soon. As the rotation of the catheter tip begins, I withdraw the catheter so that we can have an opportunity to treat the entire length of the vein. And simultaneously, the sclerosing agent will be injected. The rate of withdrawal is typically about 1 centimeter every 6 seconds. So now the connection to the device through the sclerosing agent has been achieved. You're going to hear a little beeping noise, and we're going to start the catheter in a minute. Now remember, again, there's going to be a sensation of a vibration, okay? As we start the procedure, the junction with the popliteal vein is occluded by the ultrasound probe for several seconds to ensure that there is no entry of the sclerosing agent into the popliteal vein. So here we go, we're going to start. You're okay there? Mm-hmm. Excellent. Excellent. You're doing just fantastic. So as you can see, I'm withdrawing the catheter. Again, we try to do it at a rate of about 1 centimeter per 6 seconds. And all the while, I'm injecting the sclerosing agent into the vein as I'm withdrawing the rotational catheter. The ultrasound probe still occluding the saphenopopliteal junction for the reasons that I mentioned. We want to make sure that the sclerosing agent doesn't get into the popliteal vein. How you doing? Okay. Wonderful. Well, we're doing very well too. So everything is going very smoothly. Okay, let's go ahead and bring the catheter out.
Okay, and then can I just have you flex and point your foot about 20 times? You're going to lift up your leg, you're going to flex and point. Okay, do that 20 times, please.
How you doing there? Wonderful. We're done. You did just fantastic.